Have you received a surgical indication? Is your prostate surgery already on the calendar? If so, you are likely feeling a mix of relief that your symptoms might finally improve and anxiety about what the procedure actually entails. Today, I'm going to walk you through 5 critical facts that you absolutely need to know before you undergo any procedure on your prostate. Unfortunately, far too many patients only discover these realities during their postoperative recovery, often in a way that isn't very pleasant. They wake up surprised by side effects or outcomes that they simply weren't expecting. This video might change how you approach your surgery, or at the very least, ensure you arrive on operation day much better prepared and confident. Remember, a patient who is well-informed always makes better decisions. And stick around until the very end, because as a bonus, I will share a 6th recommendation that can drastically improve your recovery based on a simple step you can take before the surgery even happens. Let's get started with the first fact. Number 1. Not every large prostate requires surgery. This is a very common misconception. Just because you went for a routine ultrasound and the report says your prostate has a high volume or weight, that does not automatically mean you need to rush into a surgical procedure. Volume alone is not the deciding factor. We need to evaluate the impact of that benign prostatic hyperplasia, or BPH, on your specific urinary health and your quality of life. We look for the consequences of the enlargement, not just the size. For example, are you experiencing acute urinary retention? Do you rely on a catheter to empty your bladder? Do you have bladder stones, persistent bleeding in your urine, which we call hematuria, or recurrent urinary tract infections? In severe cases, we even look for signs of renal failure, where the kidneys are struggling because of the blockage. If you do not have these severe complications, many men with large prostates can manage their condition perfectly well with clinical treatment, meaning medication. Surgery is usually reserved for those patients who are refractory to medical treatment, meaning the pills stop working or don't work well enough, or for those who have the specific complications I just listed. So remember, size matters, but symptoms matter more. This brings us to the second point, which is crucial for your peace of mind. Surgery for BPH is completely different from surgery for prostate cancer. This is where a lot of fear comes from. Many men are terrified to schedule their procedure because they assume all prostate surgery leads to permanent impotence and leaking urine. They hear horror stories and think that is their inevitable future. That is simply not true. We need to distinguish between a radical prostatectomy and the surgeries used for BPH. Radical prostatectomy is used to treat cancer. In that operation, the goal is to remove the entire organ, including the capsule and the seminal vesicles. Because the whole organ is removed, there is a higher risk of damaging the nerves responsible for erections and the structures responsible for holding urine. However, in surgery for BPH, we are treating the adenoma. Think of the prostate like an orange. In BPH surgery, we are removing the fruit, the pulp, while leaving the peel, or the capsule, completely intact. Because we aren't removing the whole organ, BPH surgeries carry significantly lower risks. We are able to preserve the nerves and blood vessels responsible for erections because they run along the outside of that capsule. While you might have some temporary urinary urgency or mild control issues while you heal, it is extremely rare for modern BPH surgery to cause long-term erectile dysfunction or permanent incontinence. The goal here is to clear the blockage, not to remove the organ. Now, point number 3 is perhaps the most important one to understand regarding your expectations. Most patients who undergo prostate surgery will experience changes in ejaculation. This is the fact that often catches men off guard. Almost all surgical treatments for the prostate can change how you ejaculate. You need to be prepared for the possibility of retrograde ejaculation, often called a dry orgasm. Here is what happens. Nearly all effective surgical treatments involve opening up the bladder neck to improve urine flow. Because that channel is now wide open, when you reach a sexual climax, the semen takes the path of least resistance. Instead of shooting forward and out, it goes backward into the bladder. It then mixes with your urine and comes out later when you go to the bathroom. From a health perspective, this is completely harmless. It does not damage your body. Crucially, it does not affect your ability to have an erection, and it does not affect the sensation of the orgasm itself, the pleasure, The climax, the fireworks, are still there. However, you will likely see little to no fluid. It is important to note the difference here between cancer surgery and BPH surgery again. In cancer surgery, the seminal vesicles are removed, so semen production stops entirely. In BPH surgery, you still produce semen. It just doesn't exit the same way. This implies that you cannot conceive children naturally anymore. If you are still planning on having children, this is a conversation you must have with your doctor before the procedure. For most men, the trade-off of being able to urinate freely again is worth it, but you need to know that the dry orgasm is a very likely outcome. Now, while surgery clears the blockage, it doesn't necessarily fix the blood flow issues that keep your erections from being as rock hard as they used to be. If you feel like your vitality has faded, or if you want to reclaim the stamina and fullness you had in your 20s without relying on dangerous pills or pumps, there is a bizarrely simple, 100% natural way to do it. It's a unique purple hardening tonic that takes just 7 seconds to prepare at home. It targets the root cause of the problem, unclogging the hose to restore full, long-lasting performance naturally. I've found a short video that explains exactly how this works. Go ahead and point your phone's camera at the QR code on the screen right now to watch it. If you're on your phone or can't scan it, I've also pinned the link to the top of the comments section below. Do not ignore your sexual health. Check that out. Moving on to fact number 4, one size does not fit all. You almost always have more than one option to treat your prostate surgically. Medicine has advanced incredibly in the last decade. There isn't just one prostate operation anymore. Today, we have a vast array of technologies and techniques, and the best one for you depends on the size of your prostate, your anatomy, and your personal priorities. For smaller to medium prostates, typically those between 30 to 80 grams, we have newer, minimally invasive surgical therapies, often called MISTs. These include procedures like RESIM, which uses water vapor, iTind, which is a temporary implant, or Urolift. These techniques are often faster and have a much higher chance of preserving forward ejaculation. However, they aren't always suitable for very large glands because they might not remove enough tissue to solve the problem permanently. On the other hand, for larger glands, say above 80 or 100 grams, we have highly effective procedures like laser enucleation. You might hear terms like HOLEP, green light, or thulium laser. These procedures are essentially the gold standard for big prostates. They allow the surgeon to remove 80 to 90% of the blocking tissue, providing a massive improvement in flow. And for extremely large glands, sometimes robotic-assisted simple prostatectomy is the best route. The key takeaway here is that you shouldn't just accept surgery as a generic term. You need to have a frank conversation with your doctor. Ask them, based on the size of my prostate, which technique are you recommending and why? If you have a massive prostate, a minor procedure might not give you relief. If you have a small blockage but care deeply about ejaculation, a MIST procedure might be better than a standard scraping. The decision needs to be individualized. Fact number 5 is something few people want to discuss, but you need to know you might need another procedure in the future. We call this retreatment. Because BPH surgery is partial removal procedure, meaning we leave the outer shell of the prostate intact, the tissue inside can eventually grow back. It can obstruct the flow of urine again. Think of it like trimming a hedge. Since the roots, or in this case, the capsule, are still there, the branches can eventually return. This is why the choice of technique matters so much. A standard TRP, or the traditional scraping of the prostate, typically leaves more tissue behind compared to modern laser enucleation techniques. Because more tissue is left behind, the rate of regrowth is statistically higher with a TRP, meaning you might need a redo or have to go back on medication 10 or 15 years down the line. Procedures that remove more tissue, like HOLEP, have much lower retreatment rates because they clear out almost everything, leaving very little behind to grow back. It is important to understand that needing a second surgery doesn't necessarily mean the first one failed. It simply means the natural disease process continued over time. Now, for that 6th recommendation I promised, the bonus tip that can significantly change your recovery experience. Do not wait until after your surgery to think about rehabilitation. You can start preparing right now by engaging in pelvic floor physiotherapy before the operation. We often call this prehab. Many patients struggle with urgency or temporary leakage immediately after the catheter is removed. This happens because the bladder has been working overtime against a blockage for years, and suddenly the door is wide open. By working with a qualified pelvic floor physical therapist before your surgery, you can strengthen the muscles associated with urinary control. Training these muscles ahead of time creates muscle memory. This makes it much easier to regain full bladder control and can even assist in sexual rehabilitation during the post-operative period. It is a non-invasive step that gives you a head start on your healing process. An informed patient is always a safer patient. If you know that dry orgasms are normal, that different techniques yield different results, and that physical therapy can help you heal, you are far less likely to feel frustrated during your recovery. I hope these insights help you have a more productive conversation with your surgeon. If you found this information helpful, please like this video and subscribe for more content on men's health. See you in the next video.